Well, we know the coronavirus has put so many of our life events on hold, and for many people, that includes starting a family. This week is National Infertility Awareness Week, and many women who have chosen IVF have had their plans derailed by this pandemic. I talked with two local women who say that the virus has left them in limbo.
I would never wish it upon anyone. It's the hardest thing that we've ever gone through.
Jennifer Fuentes and her husband Chris have been trying to have a baby for 3 years. 3 rounds of IVF have sadly ended with 3 miscarriages. In March, Jennifer had just started medication for her 4th round of IVF when the coronavirus hit and her doctor called.
They called and just said, until further notice, we just have to put everything on hold. This is not the perfect time to do this, and I understand that, but to just mentally be prepared for this, it was super frustrating.
A similar frustration for 37-year-old Julie Capozzi, who lives in Queens, one of the hardest hit areas. She and her husband Anthony had their miracle baby through IVF 2 years ago and are now trying for a second child. Julie has 1 embryo that's ready to transfer, but she's concerned about any unknown effects of the virus.
It's hard. It's hard. I try to fight back the tears, but there's just times where you have to let it out. You're already having those emotions. Now add on top of this virus that's overtaking the world.
In March, the American Society for Reproductive Medicine put out guidelines that include suspending new treatment cycles, including egg retrievals, considering canceling embryo transfers, and continuing care for patients who are in cycle.
It can be tricky because we don't know when this pandemic is going to end.
Dr. Zaher Merhi of New Hope Fertility Center in Manhattan says the biggest concern for his patients is egg retrievals.
If you wait 6 months, sometimes the woman misses her chances of getting pregnant using her own eggs.
Dr. Merhi says he's treating each patient case by case, many via telehealth services, and also offering an at-home IVF kit.
Which basically, you come to the office only on the day of your egg retrieval, so you don't have to come multiple times.
In the meantime, the waiting game continues for these 2 women. Julie is hopeful about an embryo transfer when the time is right.
It's going to be another little miracle, because you only need 1, so we're trying to stay hopeful.
While Jennifer is focused on the stay-at-home order and hopes others do the same.
The longer we have to stay inside, the longer we have to wait to start back up with our doctor, and this is something that people have been dreaming about their whole life.
A new update on those guidelines I mentioned is set to go out tomorrow. The ASRM will notify its members first, and we will, of course, find out the latest for you.